Yeah, let me just start with introducing Mackenzie Williams. She is one of the sponsors of the film. Hi, how are you?
Hi, thanks, Chartis. I'm Mackenzie Williams, public health nurse and the nurse training manager for the Vaccine Confidence Project team at the National Nurse-Led Care Consortium. And we're so happy that you all joined us today. NNCC is a nonprofit member-supported organization. Our mission is to advance nurse-led healthcare through policy, consultation, and programs to reduce health disparities and meet people's primary care and wellness needs. We are representing the intersection of nurse-led primary care and public health. Together, in partnership with the Centers for Disease Control and Prevention, we are building COVID-19 vaccine confidence among nurses and the communities they serve, in order to empower nurses with the necessary information to engage with care teams and communities about COVID-19 vaccines, to provide learning opportunities, to share up-to-date guidance and support peer engagement among nursing colleagues, and to amplify the nursing voice by featuring everyday nurse champions through our podcast and other media. So when we heard about the opportunity to co-sponsor a screening of this fascinating film, we were so excited to promote something as it's so in line with our values, to keep COVID-19 vaccination and evidence-based information in the national conversation. We are a subsidiary of another of our sponsors today, so I want to also say a bit about Public Health Management Corporation. They are a nonprofit public health institution based in Philadelphia, Pennsylvania, that builds healthier communities through partnerships with government, foundations, businesses, and community-based organizations. PHMC provides outreach, health promotion, education, research, planning, technical assistance, and direct services. PHMC is one of the largest and most comprehensive public health organizations in the nation. So thank you. And to introduce our final sponsor of the day, I'll go ahead and ask Melody Butler to take it. Okay.
Hello, and thank you. It's a pleasure to be here as a co-sponsor for this very important documentary. I am the founding executive director of a nonprofit, Nurses Who Vaccinate. Nurses Who Vaccinate is a nurse-driven member organization. Our members are from a variety of backgrounds, such as RNs, LPNs, nurse practitioners. We even have doctors and parent advocates along part of our team. Now, Nurses Who Vaccinate, one of our main roles is to provide evidence-based research and information to help nurses be able to provide education to parents, patients, communities, and to be a resource in vaccine information deserts, such as social media platforms, and provide tools to help to aid in educating and advocating for life-saving vaccines. We play a very important role in the vaccination and advocacy community, and we provide collaboration and support for research and education in workplaces, communities, and on the internet. So thank you.
Well, thank you. And thank you both, Mackenzie and Melody, for sponsoring this screening. I would now like to invite everybody, all the attendees, to start submitting questions to us, and I will direct those questions to the proper person to answer those questions. And I'd like to introduce Laura Davis. She's the producer of the film, my producing partner and wife. She did a lot of the research and the interviews, and then also did all the cleared all this archival footage that we used. Laura Davis.
Hi, I want to echo everyone's sentiments, and thank you for being here. This is very exciting for me and Chartis to present the film to members of these two groups, because as I just said to Mackenzie and Melody, we've screened it for many groups of healthcare providers, but this is actually the first time we've screened it to specifically to or for nursing organizations. And I always remember something I read early on in the project, that nurses are among the most trusted healthcare providers across all of the healthcare professions. And so it's significant to me that they chose to be involved in the film, and that if you're watching or have watched the film, that you're here now. So thank you. And I want to echo Chartis, just start submitting questions if you have them for any of our panelists or for us filmmakers. through the Q&A feature of Zoom. And I would like to introduce Catherine Grinnan, who you see at, I don't know if you see her at the bottom of your screen, you probably do. And Kathy is one of the stars of our film, and somebody that really opened my eyes to misconceptions I had about people that had questions about vaccines. Kathy or Catherine?
Yeah. Thanks for having me. I'm really happy to be a part of this panel and to clear up some of the issues and struggles I went through while making these decisions for my kids. And I really feel like that this film's super important. And I feel like the film is done very fairly to all sides, respectful to all sides, and I'm really happy with the outcome.
Good.
But thank you. Yeah, and ask me anything.
Thank you, Catherine. And yeah, you know, as a filmmaker, you're always kind of attracted to the interviews that become golden. You know, they always kind of bubble up to this to the very top, actually. So thank you you had such a poignant story to tell, that and people are naturally attracted to that because you asked a lot of questions. You had a lot of questions that then, you know, other people have as well, and so people can really relate to you, and also to Corey, who also had, you know, hesitancy, you know, about vaccination, and came around. You know, those are really seeing that arc, you know, throughout the film. I really try to kind of show that. In many ways, and people are listening to that in some ways more than to the experts. The people are emotionally attracted to that, so that is really great. So I'd like to again, you know, invite everybody to submit questions. And in meantime, I can talk a little bit about why we made the film. You know, originally we had made a film about Jonas Salk and his development of the polio vaccine. And this was back in the 50s, you know, when polio was a real, you know, it was a scourge. Everybody was so afraid of it. And it was such a visual disease, seeing children in wheelchairs and in iron lungs. So we did that a number of years ago. And then we were at a certain point wondering, you know, should we do a follow-up? And we were wondering what is going on. And this is just before COVID, actually, a few months before COVID. And we kind of discovered that there were kind of pockets of people who were hesitant about, you know, it was chickenpox and measles, essentially. Those were the main diseases that people were worried about vaccinating. And then, of course, COVID happened, which kind of blew everything out of the water. And we had to actually redo a lot of interviews in order to make it current, and then trying to stay current because everybody was experiencing a pandemic in real time. And it was changing week by week as the information was kind of coming out and we were discovering how to handle this. So it's interesting because one of the things that we have found, you know, we've interviewed a lot of experts, obviously, and parents, and also people, you know, who know about social media, and because it really has its tendrils in just about every aspect of our lives now. And it's, of course, being politicized, and it's a, you know, this huge subject. So it became really a challenge to try to compress all this information into, you know, something that could be watched, you know, in one sitting. So let me see. I have a question here. That is, Virulent makes clear that social media is a powerful conveyor of vaccine disinformation. Are lawsuits a promising route to force social media companies to clamp down on misinformation? And do you support this tactic? That's a really good question. Mackenzie, do you have any thoughts about that? Will I try to formulate my own idea?
Right, the question asker does point out that it's so evident in the film how impactful social media can be, and I think for a lot of reasons, but I think people, there's some trust in healthcare, there's some trust in government, but there's nothing like a a personal anecdote or someone you love or trust saying, this worked for me, this didn't work for me. So I think, in the beginning of the pandemic rollout, we were getting a lot of new information because we didn't know a lot about COVID. So sometimes the guidelines were changing, and there were a lot of reasons why people kind of started to distrust, official guidance. And so people turned to their communities for support. And I'm not a social media expert, but it does feel like, some amount of oversight is appropriate. And as to the route of lawsuits, I'm not sure. I know Melody has a strong social media presence. Do you have a thought on that?
I have many. So on that note, so here's the thing: the disinformation is not just limited to vaccines on social media. My concerns with social media is how anyone can say anything and not be held accountable. For example, someone can make the recommendation that to clean your toilet bowl, you should mix ammonia and bleach. Someone can do that. And let's say this comes from an organization that's really out there promoting, a certain type of cleaning. Someone follows that recommendation and they create, mustard gas and, end up hurting themselves or killing people. Can anything be done to that person who put that initial message out? Or, for example, we've seen in the autism community, parents were coerced or scammed into giving children bleach enemas, right? It wasn't called bleach, but it was called special mineral oil. And because there was this whole theory out there that the autism is really being caused by an infection in the gut. And if you cleaned out their colons, that you would get rid of the signs and symptoms of autism and cure your child. So what ended up happening? Well, you would have children receiving these bleach enemas who then would be perceived as, excreting worms. But the really wasn't worms, was actually the inner lining of their intestines, and they were eroding away their GI system. So where's the accountability to that? Those poor parents were doing everything they could to, they're doing their research online, and they come across these websites that are toting dangerous, harmful, potentially life-ending misinformation. So it's not just limited to vaccines. There is across the board a danger on social media, and there needs to be accountability. Are lawsuits the way forward? Well, if I'm told by someone online that to do such and such, and they're touting a sense of credibility and authority, and they're saying that, well, I am an anti-vaccine expert, right? And I've been writing these books about how dangerous vaccines are, and then I go to choose not to vaccinate my child, and my child ends up developing a potentially, life-threatening disease. There is some merit there that you took advice from someone online who was, posing with whether it was real or fake authority. There needs to be accountability. And that is a great discussion for maybe a 4-hour webinar one day. So thank you.
Wow, thank you, Melody. And boy, a bleach enema, I thought I had heard everything with all the material that I've gone through. That is really incredible. That reminds me also of a kind of an anecdote that Laura and I went through when we were actually making the film. At a certain point, people tend to trust their peers, right? More than experts, actually, in many cases, because they don't know what to trust anymore. There's so much information out there. And I remember that at a certain point, we were returning from doing interviews, and we were at LAX, and we were going, to the place where you hail an Uber. And the lady who was hailing Ubers, she saw our equipment and was wondering what we were doing. And we were saying we're making a film about vaccines. And she immediately assumed that we were making an anti-vax film. And as we all know, there are, so many anti-vax films. When you look on Netflix, you can find probably 10 of them. And she said, oh yeah, the vaccines, I just, I have a friend who just had a baby, and I told her not to vaccinate. So here you have somebody who is hailing Ubers, giving advice, giving medical advice. It really kind of illustrated, what we're up against in many ways. So I have a question from Melody, and this question is, how do you talk to hesitant parents who may need a lot of, patience, and you guys are the ones who are really in the trenches. You're the direct contact with the public, and often a very skeptical public. How do you do that?
That's a great question. So your patients are, when you're working in the health field, patients are going to have questions and concerns about everything, not just limited to vaccines. So as a nurse, as a healthcare provider, you're kind of used to educating, for example, newly diagnosed diabetic patients. They may be in denial, and it's going to take some time for them to comprehend that being a diabetic is a lifestyle change. Your whole diet's going to change, going to family functions. Especially if you're type 1, the need to administer insulin on a daily basis, depending how what your diagnosis is. So helping patients to understand and grasp medical literature that's what we do. So when it comes to vaccines, I've always kind of taught and encouraged nurses to treat vaccines similarly, like you would with anyone else who has doubts and concerns. So, but I mean, vaccines are a hot topic, and that tends to be what we're always talking about as of late. Usually parents are not fighting you when you want to give them an antibiotic. You don't really need to convince someone who's coming in with pneumonia, yeah, you probably should take this. They're not really asking questions. So, but it does happen every so often. But with that, it's developing a relationship, developing a rapport. And listen, this can be done in the emergency room. This can be done in a one-time setting. And then also, obviously, we would like to develop lifelong relationships with our patients, but that can always be done in maybe a triage setting. But letting them know that you're there for them to ask these questions, that you're non-judgmental. I like to call it my nurse face, right? I've seen this before. What you're asking is normal. It's okay. These are valid concerns. And then I go to, why should they take my advice? Why should they take my recommendation? Whether I'm an expert, I've attended trainings, I've been a nurse for over 10 years. I know the safety, and I know the mechanics, and I know the research. You build your credibility with them. And then you provide the science. But you always want to make sure you ask them if they want to hear the science. Because you have to make sure that when you're educating, the person you're talking to is being receptive. And maybe that initial conversation is not the time to provide the science. Maybe that initial conversation is just to establish that relationship. And I know we like to get things done quick. We like to give them the medications, move on, and save the next life. But it is a skill that's learned. It's a conversational. It's a people skill. Developing those connections, so people see us as a valid resource, and that they come back when they have future questions, because they're going to. And it's just really important to establish your credibility, set up that trust, and then go from there. That way, parents and patients, they have that ability to reach out. They have a phone a friend, and you become their lifeline for questions and concerns.
So Susan has a follow-up question to that. What do you say to parents who want to vaccinate their kids selectively? This vaccine, but not that vaccine. Do you have an approach for that? How do you deal with that?
So I have, I don't want to say matured, but at this point, I'm happy when anyone vaccinates, right? I am going to, of course, let them know that my own children were vaccinated on time, on schedule. That's what the science recommends. That's what the research says is the best way to do it. It's been studied, these vaccines, the schedule, because when you delay, you're putting your child at risk for potentially contracting that disease. So if someone was to say, my child's supposed to get vaccinated for the flu, MMR, and the DTaP, in one visit, which one should I get first? I'm like, wow, of course, depending if it's flu season or not, what are you most comfortable with your child having to deal with? Do you want your child contracting flu, or do you want them, right now, measles it's out there, right? Do you want to have to worry about your child developing measles, or if they're playing outside, tetanus? Tetanus, even though it's not transmitted person to person, tetanus is always a threat, no matter what time of year it is. We have had children contract tetanus, and in other countries, they recently died. Here in the US, there was a case study. A child spent several weeks in the ICU, was ventilated, intubated. We don't know what the lifelong complications are of that. So which disease are you comfortable putting your child at risk for developing? Now, with that being said, there's always ways to work with a parent and a family to get them vaccinated. And if that means setting up repeat visits, then so be it. But of course, I'm going to let them know first and foremost, that is not my recommendation. I strongly advise sticking to the science, sticking to the schedule, because there's a reason for that. And that's how I would lead that conversation.
Yeah, that's really interesting. And you're very good at explaining it. I mean, if I had any hesitation at all, I would be sold right now. I was going to ask Kathy, who just came back. Where were you, where were you and your friends and your peers and your family getting their information before, before the big turnaround for you, when Hannah, had her condition?
Right. Well, at that time, I've been thinking about a lot since I gave my interviews and over the years, but I was a very young mother. So when I was looking for information on what was the best thing to do for my child, part of you would do what your mother, your family had done. So at that time, the information on vaccinations were coming through like pamphlets and flyers at church, and things like that. Can you hear me? Okay.
Yes.
Okay, good. And so it wasn't, because this was like super pre-internet, social media kind of stuff. So it was kind of word of mouth through just family members, extended family members. And, I will add on top of that, growing up in a small town, which I find super ironic that, some of the farmers wouldn't vaccinate their children, but they vaccinate their cattle, and ranchers, they vaccinate their cattle. So it just was, I was receiving very limited information, and most likely none of it based on science, most of it based on reactions to certain immunizations, and whether your kid would be on the spectrum of having a really bad reaction or no reaction whatsoever. So and in the film I explained my first 2 or 3 children, I think it was my first 3 children, were fully vaccinated. And then, I got kind of received, was bombarded, I would say, with a ton of misinformation, or maybe not so much misinformation, but because people were trying to do well, but information that isn't based on science. And then I got scared. I got scared to continue to vaccinate my kids, because I felt like at the time that it was kind of a Russian roulette, like, well, so far my kids are okay, but if I if I vaccinate my younger children, or any child that I have, when is it going to be the vaccination that hurts them? So it was just a lot of, for me, it was a lot of, I didn't have a lot of great information. And I had a lot of just communal type conversations, and even an old, I would call him an old school pediatrician, who was my husband's pediatrician. I didn't feel like at that time I got a lot of guidance from him. And then when you fast forward, so I would say my kids were kind of half and half vaccinated, the other half not vaccinated. So when my daughter had her heart transplant, and we meticulously found a center that we felt would give her the best outcome, and a nice healthy life. And so as I'm trusting all of this team of transplant surgeons, immunologists, cardiologists, the whole team, there's 12 or 15 people at least. And as I'm trusting everything they did during the heart transplant, when they are just going through a checklist and saying, well, now your other kids are vaccinated, right? Before we let Hannah go home. And that's when we really had to just fess up and say, well, yes and no. And so, we were really super fortunate at the time that the immunologist that took the time to sit down with my husband and myself and explain uh, exactly what immune response is and how it works and how it works with Hannah and why she does need herd immunity. What is herd immunity? And I for sure was not going to be that mom that was going to endanger not only my transplanted child, but my transplanted child's new heart. So we have an additional obligation to take care of the gift. So I would say it was twofold. There was taking care of my child and then taking care of the gift of a heart and what are we going to do to make sure that she it gets the best care possible, and that meaning her siblings needed to be vaccinated, period. And so we got on a vaccination schedule, and the little toddlers were not happy about that, but now in looking back, everyone is an adult and they really understood, how we did that accelerated vaccination routine for the kids that weren't vaccinated.
Such an amazing story. And I mean, it's something that everybody can relate to. I mean, I think anybody who has children who can relate to. It was really good to hear too, before we started the session, that she's really doing great.
Yeah, she's doing well. She just turned 25 and she's doing fantastic.
Isn't that amazing? Yeah, a
Hey,
gift.
Chartis and
Yes.
Kathy, forgive me for interrupting,
It's okay.
but there's a couple of really good questions and points that are being made that I'd like to jump in with now because
Sure.
they're in follow-up. One is that somebody, an anonymous attendee, pointed out that there is a difference, of course, between misinformation and disinformation. And Catherine, you were likely, and I agree with this opinion by the person who submitted it, you were likely on the receiving end of misinformation. In other words, stuff that wasn't true, but was not being shared with malicious intent. As you say,
Right.
These are people that thought they were doing the best thing for their kids. And
Right.
misinformation is different from disinformation, which has a malicious intent. And I think we can safely say is coming from people like, RFK Jr. and Del Bigtree and Joseph Mercola, who's not in the film, people that are making bank off of it, that are just flat out making money. And they understand that what they're saying is not true. Maybe they believe it on some level, but I kind of don't think so. And then the other thing I wanted to ask, again, a question from a viewer, and it's really for Melody and for Kathy. It's kind of a two-part question. Virulent touches on the intersection of vaccine disinformation and white nationalism and, anti-Semitism too. And in fact, David Gorski, who was one of our sponsors earlier on our science-based medicine screening and webinar, his opinion is, as he puts it, scratch an anti-vaxxer and 9 times out of 10, you'll find an anti-Semite. So for Melody, I want to ask you whether you think that's true, or whether you would agree with David's characterization. And why do you think this white nationalist anti-Semitic thing is, why is that suddenly so closely aligned with anti-vaccine sentiment? And then part 2, Kathy, keep this in mind, is did you ever see this connection in your own life when you talk to people, friends or family who encourage vaccine skepticism? So Melody, if you would.
So I'm going to be very honest. If I find out that a patient or maybe someone who's talking to me on the internet is anti-Semitic, I kind of do stop the conversation. It's one thing to educate a patient or someone who has legitimate concerns, but anti-Semitism, it's hate. That's a whole nother ball game, and that's not them being concerned about the ingredients in the vaccine. That's that involves different tactics sometimes with dealing with. And I do find a lot of times with that, there's a lot of anger behind it. They tend to be very, they're not on the fence. They've made their mind up. Now, granted, there's always hope. I always have hope when I'm educating and providing information to the public, to communities and whatnot. But I have found, at least in the more recent months, when someone is coming across with concerns and they start to draw in these types of claims and conspiracy theories, I have, for my own mental health, I have developed more or less a soft heart, a hard stop. And at least I take a break, because now this is this is a different conversation. I will say it has always been present in the anti-vaccine movement. What came about, it was this generalized feeling of being, I hate to draw in a Harry Potter reference, but being pure-blooded, right? And it was more of a pride that their genetics was so superior and so strong. They didn't need the help of scientists and the medical community to protect them from diseases. And of course, they would draw comparisons to other races and ethnicities and saying, well, maybe they need it because their countries are so much more poor than ours, and they don't have the genetic composition, the superior whatever. But that used to be so far removed. It would be very rarely, I would see it, but it would be rare. And it was very easy to say, okay, that person, that is not my cup of tea. That's not my, I'm not, but unfortunately, it's rampant. And I can say just from this past week, with my dealings with Twitter, with, educating online, I would say 25%, maybe not anti-Semitic, but definitely has this undertone of hate speech and just this anger behind it. And it's more, I don't know if, people are, I guess they feel more freely to express these views. And now, because the people are expressing these views, more people are hearing them. I have valid and legitimate concerns about how more prevalent these theories are popping up now. And I really do feel we need to be more hands-on and either letting people know this is unacceptable. What you're saying is inappropriate. It is hateful. It is damaging. I have friends and family in these communities that you are targeting, and they are afraid. And now people, the more that we allow, and we can't dismiss them, right? Because obviously ignoring it didn't do anything. And we just need to stop. I'm not entertaining your ideas anymore. You are wrong. You are wrong. And then, if they want to proceed, they have to understand that these are my boundaries. So.
Kathy,
Okay.
do you want to weigh in?
Yeah. I would love to respond. I would say I get where the question came from. I do see it, but I would have to say honestly, for me, in my circle of family and friends, there wasn't the white supremacy, race, anti-Semitic issue whatsoever. It was more of the thought of them thinking that they understood the science behind having your own immune system, not having to do with white supremacy, but having your own immune system fight off something is better than getting immunized against it. So for instance, it's kind of the old story that, when one kid on the block would get chicken pox, the other mothers would take another kid and get the kid exposed. And so I would say within my own circle of influencers, if you will, it was more, they believed truly that it was better to, for instance, get the flu than it is to get a flu vaccine, or get the chicken pox than it is to get a chicken pox vaccine, but they are, there is an argument that building up your own immune system is actually preferable than getting a vaccine. Now, having said that, that's where my experience with my family and friends, because my family and friends are not white supremacists and they're not anti-Semitic. And so, but I can see where the narrative could lump them in with that group, because and I think that that's kind of not fair either. Is just because, you know, just because you want to not vaccinate your child because you're afraid of A, B, or C does not make you a white supremacist. And I think that I certainly know a lot of people that still to this day know I was involved in this film, understand my reasons for vaccinating my other children, understand my daughter Hannah's issues, and they still, that's great for you, but I'm not going to vaccinate my kids. So, and they're not trying to be a white supremacist about it. They're trying to, they have a philosophy or a thought that you're building up your own immune system is preferable than to getting vaccinations. So I think I don't like the lumping into, it makes me uncomfortable because then I get lumped into that, and I certainly don't want to be in that group of people, you know, or my family or my friends. I don't want them in that group of people. But so that's been my experience. It's just building up, finding ways to build up your own immune system to fight off things that your body is supposed to naturally fight off. But there again, going back to my daughter who's immune suppressed, she can't fight off things. So then that opened up the whole other conversation of, well, if she can't fight off things, we have to make you know, almost certainty that we have her around people that are immune, you know, or that have been vaccinated. So, and that's been a semi-difficult thing to navigate through the years. And now that she's 25, we've come to the point we can't change the world. She certainly isn't around people that are openly sick, ill, or whatever. And we just try to take the best precautions that we can. But in my experience, just to kind of circle back, I absolutely did not have the white supremacy, anti-Semitic experience whatsoever at all.
One of the things that we really found, you know, as we were testing the film, that really people, you know, are most attracted to the parents' stories. I mean, you know, in some ways, ironically,
Yeah.
again, you can trot out all the facts, but those are the things that, of course, really resonate.
Right.
So, you know, one of the questions that we have here from Lauren is, you know, why is it that it seems that the anecdotes of people being vaccine injured is more prevalent actually than the opposite? You know, that's one of the points we really try to make in the film, was not to be interviewing, you know, those people, because most of the anti-vax films are of course putting the people forward who have, you know, terrible stories of vaccine injury. And it's a really difficult thing. I mean, there is something in the media that's where they say, you know, it bleeds, it leads, right? I mean, we do tend to kind of be more, you know, of course, scared. I guess it's a natural impulse to these very dramatic stories of people losing children. And that's why it was very important for us to put stories in there of parents who had, you know, terrible things happen to their children who did not vaccinate. That was a very important point that we wanted to make. Laura, do you want to speak to this as well, since you did a lot of the interviews?
Yeah, you know, the question and the part two of the question actually is, why do these stories of supposed vaccine injuries resonate more strongly for people than what for me are equally powerful stories of people that died from COVID or from other vaccine preventable diseases or suffered permanent harm? I wish we had a psychologist on this panel, because I honestly don't know why that is, particularly because when someone is really sick, they're sick. It's not pretend sick. Whereas when people tell stories about children or other people, grown people that were vaccine injured, I'm not saying it's never true. Obviously, nothing is risk-free. There are people that are harmed by taking an aspirin, by getting a vaccination. But of course, very few of us. I don't know why. So I'm going to ask any of you on the panel, Mackenzie, if you'd like to hop on, Melody, Kathy, I mean.
Laura, I wanted to when you were talking about taking an aspirin, this is one of the things that, and I don't know if I mentioned her name in the movie, but it was Dr. Sandra Nelson Canarella, and she has 4 PhDs in immunology. And she was the physician that broke things down for us and really made everything, make sense. And when she was explaining that if a child or infant did have a reaction to a particular vaccine, in that margin of error, I guess what they would call it, is that it's not really the vaccine, it's really the immune response to the vaccine. So since we're all different, we can all have a different immune response. That if 100 kids are receiving the same vaccinations, and 2 kids are having a serious something happen, and I know that's a made up figure, don't even, but she was explaining how our immune system responds to foreign things in the body, and sometimes they have a horrible response, and sometimes they don't have a horrible response. So she wanted to put us at ease, that not to be afraid of the vaccine itself, but to just understand that the immune response to a vaccine is really what people are afraid of,
Melody, thank you, Kathy. Melody, I'm thinking of an example in the film, that of Katie Clovis. She was the mother who, in her own words, when she called 911, had co-slept with her infant daughter, and she was buzzed. She confessed, or admitted, I should say, that she had had like a whiskey sour before she went to bed. And I mean, clearly the baby was accidentally suffocated. We tell the story in the film, and it's a tragedy, and nobody would suggest for a minute that she suffocated her baby on purpose. But I can understand more why she would convince herself that it was vaccines that the baby had had. But why were so many people, just to use that single example, so much more willing to believe it was the vaccine than all the evidence they see around them of people getting really sick because they didn't have a vaccine? I think I didn't ask that question well, but I think you get the gist of it.
So as a nurse, I have seen patients suffer. I have seen patients die from vaccine preventable diseases. But I know that sometimes I'm very hesitant to talk about those stories because of HIPAA, right? I can't, and I wonder sometimes if the reason we don't share more stories about what happens when you don't vaccinate is because of that hesitation of sharing people's information. So when you have a story like Katie, who's willing to spread it everywhere, it's kind of filling this void. We do have parents. You interviewed one for your documentary who, when she lost her daughter to meningitis B, right? Who are out there, and they're trying to spread the message. But not everyone knows that they can do that. So if you lose a family member to flu, if you lose a family member to meningitis, they don't know that there's organizations out there who are willing to help them spread their message, because they're not preying on them. They're not, Families Fighting Flu, an organization I work with, is not out there on message boards and Facebook looking for parents saying, I lost my child to flu. Anti-vaxxers, on the other hand, are scouring these Facebook posts. They will actually search on a regular basis for, they have alerts set up. I know this, but I've seen them say this. They have Google alerts set up for newspaper articles about dying suddenly, and they will jump on that, and they will use that as part of their means to erroneously connect vaccines to this death, even though there's no proof of it whatsoever. And so you have these anti-vaccine individuals, organizations that are preying on these and who are willing to then amplify a handful of stories, right? There's a handful of people who had legitimately a legitimate vaccine reactions that really are concerning, right? And we always, as a nurse, we're always educating about, no matter what the intervention is, even in it, not just a drug, but a procedure, what the side effects are, the complications that occur, what you have to look for after you receive it, right? We will never hesitate to let people know what could happen if you choose to or not take something or do something. But with that being said, though, when you have, individuals who are out there actively campaigning to find these stories, and then they have the resources to amplify them. Like I don't know, sometimes I have many patients I've taken care of who now have lifelong complications from COVID, but I'm not able to share their story because it's not my story to share. I can share it, without the patient's name and stuff, but because Katie's putting the picture with the name and the details out there, it has more weight as me saying, yeah, I know 100 people who died from COVID, but I can't, it doesn't have the same. I think when you talk about the psychologist and psychiatry, there is something too that when the people are more affected by a singular death than they are by the mass casualties, because we're able to relate to that personal connection. So we all, if you're a parent or you have family members who are young children, you see the picture of Evie and you connect to that poor child who passed away. But if I tell you 102 children died from flu last year, it's not hitting you the same way. Unless I give you that patient's story, their name. That child went to, on Friday night, had soccer practice, wasn't feeling good, and by Sunday they were dead. I mean, that's going to hit you more than me just saying 100 kids died. We have to, I guess, help parents and family members who have lost children to these diseases, one, feel more comfortable sharing their story without being judged and whatnot, and then also do a better job of educating about the outcomes of not vaccinating in these diseases. I mean, we're still using the same pictures from 1950 of iron lungs. People cannot connect to that, right? But if you show a picture of someone from last year, 2 years ago on a ventilator from COVID, that's going to hit more. But we don't have those pictures because of privacy laws and things like that. So, we've kind of did it to ourselves. We've kind of limited and prevented ourselves from, in the healthcare field, from sharing stories. I mean, we have case studies.
This meeting is being recorded.
Okay, thank you.
Oh.
But we have so many stories to share, but we're limited in what we can until we have to come up with a better way of doing that. So, which is why it's so important. And I saw that there is a question. Addressing these stories of vaccine injuries, why are they so more powerful? Because they have all the details and they have the meat. What we need to do is share our what story am I personally able to share? I can share my oldest having coronavirus. I can share the story of, maybe I won't get patient names, but what is it like to take care of a child sick of pertussis, in a pediatric ICU? How they turn as blue as your shirt. It's yes, it is crazy. Did you know your skin can turn that blue? It can when you are choking for a good 5 minutes because you can't breathe. Sharing more of those stories, I think, can kind of even the playing field. But we have to teach nurses and public health advocates how to share our stories, right? In a very safe and legal way. Catherine, I see your hand is up. I'm sorry. Let me.
I've never used that before, so I thought I would use it. I will tell you, in my profession, after my daughter's heart transplant, one thing led to another. I won't go over my whole career, but I was with the American Heart Association for several years, and we were trained to not use that big number of, heart defects are the #1 birth defect, and they kill more babies than cancer. Well, that's a horrific figure. But the thing is, what the Heart Association loved about me in particular is that I jumped into the fundraising of the organization, but they also had a built-in story. So I could bring so I made it personal. Congenital heart defects were personal to whatever company or corporation we were soliciting funds from. So instead of like even a graph or a chart, I agree with you. But having said that, what really takes its toll over the years is, as a parent, having to share that story over and over and over again. And it's like opening up a wound. And then as your child grows up, they go through a period of time. I've seen this over and over again where Hannah, when she was little and she was getting attention from big corporation CEOs, and they would buy her big teddy bears, we'd come to a speech and she was the belle of the ball. But then when she got to be like a preteen teenager, she did not want to share her story. She did not want to be the different girl. She did not want anything. So it's kind of this, and she's kind of now back, now that she's 25, she's more comfortable in her own skin now, sharing her own story. So there, I can kind of sympathize on the nurses' end where, because of HIPAA, you can't share particular stories. And even when you can, you have to cultivate those parents, make them feel good, make them, help them understand. And that was actually part of my job as well, because I came from a parent who went through it. The American Heart Association would have me, well, let's grab Catherine because she knows how to talk to another parent about sharing their story and what things to hold on to and what things are going to grab the audience. And, from their perspective, it was strictly to fundraise and get more money to fundraise for certain research. But so at least I was able to work with other parents. And when I talked to them and I explained to them that I understand what it's like getting up in front of a group of a few thousand people and sharing your story and how uncomfortable it is. And I feel like I put them at ease a bit, and then I would help them with their speech. But all of that takes time that sometimes you guys don't have. I had the time because that was my total job, was cultivating other stories, which equaled dollars. So
Yeah, and
I do feel the pain on that.
and speaking of time, we only have a few minutes left, and this is such a big subject. We could be talking about it for hours, I'm sure. So I would again, encourage any last minute questions. I was going to ask Mackenzie, there's a question here. A recent training that one of our attendees took emphasized that unless a patient can repeat in their own words the treatment of the action, the treatment action, they don't have informed consent. Is that asking too much of patients? How do nurses convey complicated science in language that lay people can understand?
Yeah, thank you to this questioner. I think informed consent is so important. It's also important to know your patient and to speak in a developmentally appropriate way. I'm not going to present a vaccine the same way to a 5-year-old as to a 30-year-old, as to someone who perhaps might have an intellectual disability, or you have to know who you're talking to. So I think there's some really key things that go into informed consent, right? What is this drug that you're getting? Does it treat? Why? What are the benefits? What are the risks, and what are the alternatives, right? If you don't take it, or if there's another option. But I think, I'm not sure what this workshop was saying equals informed consent, but to be able to explain the exact science, the mechanism of action of the immune system, I certainly think, again, knowing your patient in front of you, if they would like more information, asking permission to give that, I think, is always a good, but to be client-centered, I think, just making sure they have a good understanding and that they feel comfortable. But yeah, that's a tricky one. I think we rely a lot on clinician judgment in those cases.
Yeah, it's kind of like what, one of our interviewees said in the film. You have to meet people where they are in a sense. And it's interesting. I mean, with all the experts that we interviewed also, I always found that if I couldn't understand it, it wasn't going into the movie. It had to be, understandable for everybody, of course. So, if you have any other
Melody had a question for you, Chartis.
Okay, right. Okay. Let's see. Did you leave anything out of the film? Yeah, right.
You wish you could have included. We left.
Yeah, I mean, each of these subjects, that we kind of touched on, and again, there is so much there. It's every aspect of our time really could have been a feature by itself. We felt we really had to be very careful about what we put in, make the point about it. And so you're actually looking for patterns of representation for things in a sense, to make it palatable, to make it watchable for people, and also that they can grasp it. So yeah, I mean, is there? I mean, I think there were more parents. I can't remember this pretty lady's name. I wish I could have put her in there. And there's also a sort of kind of proportionality that you're trying to get across when you're dealing with, a 90 minutes or a 95 minutes time limit, because everybody's attention span is short these days, so you have to really, you're looking for certain themes that you're trying to highlight in a sense and build an arc from beginning to end, and come to some conclusions, because it is such a complicated subject matter, and such an emotional subject matter for everybody, because we all care about our kids. So yeah, I think I don't know if that really answers your question. It actually just asks more questions in a sense.
I have not a final saying, but I tried to put in for the participants or the attendees that if they come up with any other questions for me later, but I think my email only shared with you guys. So if there's a way to share my email with the attendees, and if they think of a question later they want to ask me, you can share my email with them. That's fine. And then I also want to say, particularly to this group, if Hannah does like to share her story, not just about vaccinations and that journey, but if anyone in the nurses group feels like any organ donation or transplant related panels, she would love to be on, or we would love to be on together, because she's getting kind of back into sharing her story a lot. She really thinks it's important now that she's kind of been through moving away from home and taking care of her own medical issues and stuff like that. So she actually wanted me, she said, well, let them know they can talk to me anytime. So, which I thought was kind of cute.
Yeah, and I think that is so great, and we really wish that we had more parents like you and like Hannah, who would step forward and make themselves available for this, because again, that is the thing I think that really hits people, So I think this has been great, and I thank you again for sponsoring the film. That is the most important thing, to get eyeballs on it. That's why you made it, to get as many people to watch it as possible. And each of you had a really, really interesting things to contribute. And I wish we could make this 2 hours.
I know,
We will have to get back to work.
Yeah.
But I will now pass it on to Laura. I think you had some things to add to the end of this. So Laura, please.
Yeah, just well, first of all, I want to say thank you again to Mackenzie Williams and her colleagues at National Nurse-Led Consortium and their parent company for sponsoring the screening. It means the world to us. And also, I love nurses just based on my own experience. Melody, you said something to me once about why do people go to the hospital when they need nursing care? How did you say that? Is that basically?
So,
what you
yeah,
said?
yes, you go to your doctor's office when you need a prescription or a diagnosis, but you enter a hospital because you need around-the-clock nursing care. The
Yeah,
doctors are not at the bedside, it's the nurses who are going to be your friends. So that's where we are.
yeah. And nurses truly are among my heroes. So thank you to you, Melody and Mackenzie, for the organizations that you belong to, or in your case, Melody founded, sponsoring this screening. Kathy, thank you so much for sharing your story. And I actually thought I would give out our email address because we didn't get to all the questions. And so our email address is screenings, that's plural, screenings@virulentmovie.com. And anybody watching this who would like to submit a question or resubmit a question that we didn't get to, please feel free to submit it. And I would be happy to forward it to any of the people that are participating here and either relay their answer or they may want to respond directly. So screenings@virulentmovie.com if you'd like to ask a question, or if you belong to an organization that would like to sponsor a screening. Thank you.
Thank you.
All right. Thank you, everybody.
So many insightful questions in the chat. I wish we could have gotten to them all, but thank you so
Yes.
much for your time, and to Laura, Chardis, Melody, and Catherine for joining us today.
Thank you very much.
It was a pleasure to be here. Thank you, everyone.
You bet.
All right.
There.
All right.
Have a great weekend, everybody.
You too.
So,